All right, everybody, welcome. I'm Dr. Jay Cook. I'm the Chief Medical Officer here at Providence Regional Medical Center, Everett. I'm a vascular surgeon by training, and I've worked in and served this community since 1991. I'm really happy to be your moderator this afternoon, and we're all glad you're here. Welcome to Providence General Foundation's Innovations Prov. This is a speakers series connecting you with our Providence experts on topics you've said you want us most to cover. This is the second in the series, and today's topic is behavioral health in COVID times. Judging from how many registered for this, and from what we see in our clinics here, our families and our community, this is a very timely and important topic. Many of you have invested in the work we'll be talking about today, and we're delighted to share the exciting advances in behavioral health at Providence that are made possible because of community support. Thank you for supporting the growth of these much needed programs. First, a couple of quick housekeeping items. Attendees are not visible to other attendees, and everyone will be muted so we don't have any audio interference, echoes, or distractions during the presentation. But we do want your questions. So those who joined with a computer, tablet, or smartphone can type them in during the session using the Q&A feature. The questions and names of those who are asking the questions will not be seen by other attendees. However, we can see them, and we'll do our best to get through them all. And as a disclaimer, although we have doctors and experts in this field on the panel, this presentation is not a replacement for seeing your own doctor or practitioner with your specific medical questions. The webinar content is not intended to be a substitute for seeing a professional for advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions, specific questions you may have regarding your mental health or any other medical condition. We're here tonight so you can get to know your local healthcare providers at your local medical center and hear straight from them what's happening in our field and how we can help right here close to home. So let's meet our panelists. I can't see them now, but I bet they'll be on. There we go. All right. So Dr. Kathryn Gilligan currently serves as the Medical Director of Behavioral Health at Providence Medical Center, Northwest Washington. Dr. Gilligan has worked in a variety of settings, including inpatient psychiatry, behavioral health integration, and outpatient community mental health services. She is passionate about improving access to mental health services in our community and teaching students, other medical professionals, and lay audiences. Dr. Gilligan has several tools she utilizes for her own personal resiliency building and maintenance, including painting, hanging out with her family, and playing Ring Fit Adventure on Wii. Laura Knapp is a licensed clinical social worker and currently serves as the Director of Behavioral Health for the Northwest Service Area and Director for Outpatient Care Management Services. In her role, she provides oversight for behavioral health care delivery, development, and strategy across the continuum. Laura is an established leader with almost 20 years of experience providing social services in diverse settings. Her experience includes expertise in areas of child welfare, mental health and substance use disorders, the nonprofit sector, international social work, and providing direct patient care in both inpatient and ambulatory settings. She has worked with Dr. Gilligan to grow psychiatric services at Prov Everett, including the new behavioral health urgent care and the newer yet inpatient psychiatric unit at Prov Everett. So thank you both, Dr. Gilligan and Laura, for being with us. And I'd like to start by asking you both what you're seeing in our community now in terms of behavioral health challenges in this time of COVID.
Yeah, so can you hear me okay? I mean, so I like the, some people have compared living through this pandemic to a marathon. And I think that's I like that analogy. But a marathon has an end. And right now, about a year and a half into the pandemic, it really feels like we're at about mile 38-ish. If you work in healthcare, it might feel like mile 78. And I think that, some good things have come of that. We've really had more emphasis on self-care, resiliency building, and kind of a more of awareness of mental health. So I think that has helped. So at mile 38, we're able to kind of, okay, I need to slow down. Maybe I need to help carry my friends or my family through a little bit portion of this very long extended marathon. So I think that there's, it's been rough for sure, but there are some positives that are kind of coming out of this difficult pandemic.
And just to echo that a little bit, what Dr. Gilligan said, I think initially with COVID, they looked at previous disasters and studies around that, and they predicted about between 2 million and 3 million people in Washington state would have a behavioral health need as an impact of COVID. And newer studies, now that we're actually in the 5th wave of this, is showing that probably about half of people are reporting some impact on their mental health. But again, to reiterate what Katie said, is that even though there's a lot of challenges and our community has experienced a lot of grief, a lot of stress, a lot of loss, we are also seeing a lot more normalization around mental health, and even in our own work community, talking about our own mental health a lot. And so there's some hopeful things that are coming out of COVID, even though we're recognizing the significant amount of stress people are under currently.
So thanks, both of you, for that. We know that every person and every family situation may be slightly different, but what are some general things that people can do to try to stay as healthy and resilient during these difficult times?
I think that's a great question. I think there's some really basic things that people can do. And I know it seems a little simplistic, but when people are under a lot of stress, which we have all been, it's really important that we're focusing on our physical health. And that is things like making sure we're getting enough exercise, making sure that we're eating well and we're sleeping well. Other thing that I will say is that we're seeing, and much to be expected, as people are experiencing a lot of distress, there's a tendency to want to lean into substances as a way of relieving that stress or that heartache or that grief. And so really avoiding those mind-altering substances is also really important right now. And then in addition, we have all been in sort of this state of hyper alert. We're worried about getting sick. We're worried about our families getting sick. We're responding to all of the changes in our social environment. And so because of that hyper alert state that we've been in for an extended period of time, it's really important that we develop strategies to help our body relax. And so really some typical things that can help are strategies around learning deep breathing, progressive muscle relaxation, coming up with a way to incorporate mindfulness or meditation into your daily routine, again, to really help your body combat those symptoms of panic that we've been in, and to help with that central nervous system, making sure that we get a relief from that hyper alert state. The other thing that I think can be really helpful is to really be able to focus on finding some meaning right now. So what is it that gives you meaning during this really unusual time? So that personal mission, for example, and for me, it is certainly been about making sure that I'm here to serve my community, for people that are vulnerable right now, for people who are struggling with their mental health. But for everybody, there has to be an individual personal mission that you can identify, and that really helps get us through. The other thing too is that when things are stressful, looking outward to help others in some sort of way, we do see some resiliency building there. And then the thing that I try to do every single day is just to identify one thing I want to accomplish each day. And at the end of the day, identifying one thing that I found meaning in. And that really helps me stay optimistic and make sure that I don't get kind of stuck in the rut of how difficult things are, that I really am trying to pull in that optimism and that hope, because that's really critical right now, particularly as we've been at this for so long.
Yeah, thanks for that, Laura. And I would completely agree. I'll just briefly add one thing that our family has found helpful during all of this, and sometimes it's more difficult to do some days than others, is to every day try to name at least a couple of things that you're grateful for. There's lots of things that you can point to that, are not as you would choose to have them, but being intentional about, things that are going well in your life and things that you are thankful for and grateful for, I think at least helps me personally, um, get some relief from, all that's going on. So I appreciate your comments.
And I think that's
Thanks, too.
helpful too with your friends and people at work, just sharing, what are you doing to sustain yourself right now? We've been doing that as a group, and it's been really helpful.
Yeah, that's a great
More
idea.
things to add there, just around thinking in general. So as the body gets stressed, it's really normal for the mind to start filtering in only negative things. And so to combat that, we really focus on healthy thinking in general. And so a couple little things that can help. One is sort of recognizing that we're living in a period of uncertainty, and uncertainty typically causes a lot of anxiety and distress because we don't know what to expect. And with COVID, that's certainly proven true, right? We've thought at times that we were over the hump, and here we are still in some of this. And so again, when you're struggling with uncertainty, to really focus on what you can control. And so that may mean, I'm focusing on washing my hands and wearing my mask. For some people, it may be, focusing on how they can give back in some sort of way to the community. So really taking control over what you do control and what you do know. That positive outlook that I was talking about, really when you start to see those negative thoughts coming in, to combat them with things that are positive. And much to like what you said, Dr. Cook, gratitude, when we study people that practice gratitude, there's a lot of scientific health benefits that come from that, because you are combating those negative stressors with things that are going well and just keeping a really balanced look at life. And now this does not mean that we don't spend time when we're really grieving and really feeling emotions to acknowledge those too. This is not about dismissing things that are hard, but it's about having a balance. And then the other thing that I think is really important right now is that we have all already, because we're still here, demonstrated resilience. And when we look at sort of our lives as a whole, if you can look back at a time that you were really struggling, but you got through it and identify how you did that, a lot of times you already have coping skills in there and resiliency skills in there, things that worked for you before in the past when you were going through something difficult, to lean on those. I think that can be really helpful as well.
Yeah, that's terrific. Thank you. A common question I'm sure you both get is, how do you know when you should seek professional help, either for yourself or someone that you care about?
Yeah, so I mean, we all have bad days and we all have ups and downs, but at some point, there is a point where those ups and downs are getting, too much to handle. And I think it's really important to recognize when is this something I need to talk to somebody? So there's a lot of symptoms we look at. So problems with sleep, sleeping too much, not sleeping enough, that fear kind of overtaking your life. You're feeling like excessively sad, where like things that used to be enjoyable are not enjoyable anymore. Being more irritable, quick tempered. Energy problems, too much energy or too little energy, appetite problems, we look at that, and really when it gets to the point where it's impairing your ability to function, then it is a really good time to see someone to get some help for that.
One additional thing that Katie and I talk a lot about as well is that, we would love to see a place in our careers where we start to actually look at mental health a little bit more preventatively. So all of the things that Katie just mentioned, when those signs and symptoms become so distressing that you're not really enjoying life the way that you used to, or the people in your life the way that you used to, or the activities, that's time to seek urgent help. But we would love to see people reaching out and getting help from more of a preventative standpoint. And sort of like you see your doctor for a well child, incorporating the fact that we should be seeing our physician for that mental health well check as well. So again, really kind of promoting those resiliency strategies early on and normalizing that we need to be checking in on mental health earlier.
Yeah, thanks, Laura. And that is a new way. I think it's at least a new way for me to think about these issues as a taking a more of a preventative stance. And I know that you all and your teams have really a lot of innovative thinking in this field, and we have a lot of resources to address behavioral needs in our community. Many of them are very innovative and leading the field, as particularly in our community. Could you tell us about a few of those?
Go ahead, Laura.
Yeah, absolutely. So I think, when we were talking a little bit about prevention, one of the things that we've invested a lot in at Providence is integrating behavioral health services into primary care and our women's services. So every time you go to see your doctor, you're likely getting that depression screening as a preventative screening. And if that is coming back as needing to talk with someone, we have people integrated in our clinics to do so. In the last couple of years, we've extended those services to reach pediatrics and, like I mentioned before, in our women's health. And so again, really trying to make sure that people have access when they're seeking their regular doctor care. The other thing I think that's really innovative for us here at Providence is November of 2019, we opened up a behavioral health urgent care. And that was in response to the fact that in our community, when you're in a behavioral health crisis, there's not really anywhere outside of the emergency department to turn. And so the urgent care is there. People can walk in whenever they're experiencing a crisis and be seen by a social worker or a psychiatric nurse practitioner or a peer counselor, and really get those real just-in-time services and supports that they need. And for about 30 years, we've actually had a recovery unit services as well. So we have a 14-bed inpatient unit there, intensive outpatient services, as well as outpatient care. And like you mentioned, Dr. Cook, we just opened up our first inpatient behavioral health unit here. That's a 24-bedded unit. And I think the other thing that's really important is that at Providence, we're really working with our community partners to try and respond to the access needs of our community. And with COVID, we've seen some of that really stretched thin. And so we're trying to get creative. How do we ensure people have the care they need when they need it, and trying to create the resources, supports, and services to really respond to individual needs.
Great. Thanks, Laura. I want to just remind everybody, put your questions in the chat box, and we will definitely go through them at the end. So love to hear from you. Let's flip a little bit to see, talk about a little bit about what the foundation is up to right now. As our panelists mentioned, many important and innovative processes and things we have here at Prov Everett are up and running because of philanthropy. And right now, the Providence General Foundation is near the finish line for our campaign for a greater Providence. That is a $28 million plus campaign to support some key clinical areas here in Prov Everett, including behavioral health. It also is very wide reaching and covers other areas that you'll see on your screen there, including neurosciences, trauma services, heart care, cancer care, and children's services. Individuals, businesses, and organizations have really stepped up to support the work and the mission of Providence Everett. And so far, we've been able to raise $27 million. And so we're getting really close to the goal. If you'd like to learn more about the campaign, we have a website full of information. And that site is called agreaterprovidence.org. That's agreaterprovidence.org. I'd invite you to check out the campaign and find out how you can become involved in helping create a greater Providence for the benefit of our community. The tagline for the campaign is innovative medicine, extraordinary people. And here at Prov, we definitely have both. It's been great hearing about our innovative programs in behavioral health from these two extraordinary leaders. And so let's get to some viewer questions here. So let's see. Um, so guys, do you have any advice for how to support someone who's in quarantine or in any other area of the country? How can you be there for someone even if you can't physically be there?
I think that's a great question. I think one of the reasons why we're seeing such large impacts on mental health was actually the disruption of connection with COVID. And so I think when we're looking at people being quarantined, the most important thing is to find a creative way to stay connected with them, whether that's Skyping, doing Zoom, texting, checking in, maybe helping them with their yard work or bringing them a meal. Really, when people are isolated, the most important thing we can do is simply find a way to connect.
Great. Does here's one maybe for Dr. Gilligan. Does talking about someone's mental health or about suicide make it worse?
Yeah, absolutely not. It actually makes it worse not to talk about it. And so we always encourage kind of open dialogue and honesty, and don't be afraid to ask. Good question, Jay.
We always tell people these are very treatable conditions, and they are medical conditions, whether you're struggling with substance use disorder or a worsening behavioral health condition, and they're treatable. And if we can't talk about them, somebody, we're afraid to talk to somebody we love about them, that we really prevent providing the right medical treatment for them.
Absolutely.
Thanks. This looks like a screen of the mental health resources that we have.
Yeah, I think one of the questions I get asked the most is, what do I do if my family or my loved one's in crisis? And so we wanted to make sure that people had the 24-hour crisis line. The SAMHSA National Helpline also can connect people to substance use disorder treatment and recovery services. And of course, somebody is local, going to the behavioral health urgent care, walking in and being seen. That's also an option for anyone who is experiencing a crisis.
And just to add, we're open Monday through Friday from 10 to 5. We take all insurances, so there should not be any barriers there.
That's great. What else?
So I'll take the first one. And this is one of the most challenging questions. And I don't say that to discourage anybody, but the question is, how do you find a good therapist? And I think one of the reasons why we opened up the behavioral health urgent care is that we had talked with so many individuals who are really struggling to navigate a pretty complex system. So I have a couple suggestions that I think work really well. One is that, typically speaking, your insurance will have a list of providers who are in network. And so if you get that list, what I always recommend is that when people are setting up their first counseling appointment, that they actually interview their therapist. So much of whether something's going to be effective or not is about fit. And so coming up with a couple questions that are important for you and asking them of the therapist to find out if they're a good fit. Because the worst thing for people, at least what I get a lot of feedback on, is that you share your whole story and you find out maybe this clinician doesn't have the skill set that you need, or the treatment that the treatment modality you're seeking they don't have. And so feeling really confident that it's okay to set up a phone call in advance with the therapist and interview them. I also say that if you're really struggling, go to your primary care physician. They work with people all the time on getting them connected to services. At Providence, we have a process and a system. If somebody wants to be seen in the clinic, they can be seen by our integrated therapist. Or if they want a community provider, we help them with that navigation process, because it can be complicated. So use the resources around you, whether that's your primary care doctor or your insurance company, and then really feel confident in the fact that you can interview a therapist until you find a good fit, because it can be, it can really make a difference on the outcome of how you feel like your treatment's going.
And just to add to that, there are a number of kind of online therapy services now that you can access anywhere. So that's another modality to look for if you can't find anyone locally to see.
I see another really good question in the chat, and it says, what is the difference between seeing a counselor, a psychologist, or a psychiatrist? I think this is a great question. We get it all the time, and maybe Katie and I can answer it together. So I'm a clinical social worker, so what you would be considering a therapist, while Katie, Dr. Gilligan, is a psychiatrist. The difference between our roles is that I do clinical therapy, and Dr. Gilligan went to medical school. She's a physician and she's able to prescribe medications. Katie, anything you'd like to add there?
I think that's perfect. I mean, we even when we work side by side, Laura and I can both do a very similar assessment. It's just kind of a different, you know, what our plans are a little different, because I do focus more on medication versus therapy. So.
And then to add to that, the psychologists are trained in doing different testing as well. So for example, a neuropsych provider is really the right provider if you're wondering, do I have ADHD? And they can do the testing to determine that. So a psychologist has a little bit different training. Of course, they can do therapy as well, but they have usually a testing background. Katie, anything to add about psychologists?
I don't think so. I'm just kind of reading these questions.
Yeah. So do you have a lower age limit on the services that you provide, the mental health, behavioral health at Prov?
So when with the behavioral health integration in the PMG clinics, we actually do have a number of, we have a child and adolescent psychiatrist. We also have therapists who see children, and I do not believe there's a lower age limit for their services, but in our behavioral health urgent care, it is 18 and up right now. We are looking to hopefully expand that to teenagers soon. Also, our inpatient psych unit here at Providence is 18 and up as well.
Thanks. So there are a couple of questions that are very similar. Should adults who are vaccinated, so this is more of a vaccine question, which is fine. Should adults who are vaccinated be cautious around small children, especially at the holidays? And then the wrap in for anyone experiencing mental health crisis, how do we not alienate close family who refuse to be vaccinated while the rest of the family is? So, you know, families at the holidays, you know, I think that is squarely in the lane of the behavioral health team, because there's a lot going on there. From a vaccination standpoint, I can talk about vaccinations a little bit, but I'm going to steer clear of the family dynamics around the holidays. You know, being vaccinated is the single most effective thing that all of us can do to minimize the risk of contracting COVID. Having said that, you know, no vaccine is perfect. There never has been one, and never will be one. So I think that you know, making some accommodations, if you know, is important. I think it's important to understand if everyone is vaccinated at whatever gathering you're going to be at. You know, everyone has their bubble that they trust and feel comfortable with. And, you know, I think it's very likely and understandable and common and okay to, you know, not be masked around, you know, loved ones who, you know, you've been vaccinated and you feel, you know, pretty good about, you know, the fact that they, you know, are doing basic public health measures out in the community. You know, for those that are not vaccinated, that, you know, that is challenging in a situation where you're going to be indoors and you're going to be, you know, close together, sharing a meal, talking, laughing, etc. And that's why, I mean, that's why there are always spikes in cases after the holidays. It's understandable, you know, it's awkward to, you know, ask your uncle to wear a mask if they're not vaccinated, or to, you know, to have small children around who, you know, can't get vaccinated but may have picked it up in school. I think that's a risk that we all take. You know, I don't have any specific advice other than it is, we always see, or we have for the last, year, a spike in cases after the holidays. And I think it's exactly this. But being vaccinated, and for those who are, who qualify to get a booster, this would be a great time to do it if you're over 65 or immunocompromised, so that around the holidays you will have the, the most effective preventative thing that you can do.
This question down here is really tricky. How do we not alienate close family who refuse to get vaccinated, and the rest of the family is, and holidays are coming up, and that's a really tricky one. I mean, we always get busy right before the holidays with lots of challenging family dynamics. I think actually, like, having a therapist to kind of talk over, like how do I deal with this, and kind of help you through that would be helpful. I personally think 95% of the population would benefit from having a therapist that they talk to. But it's challenging, and it's hard to see that family member that you love are actually putting themselves at risk by hanging around your kids and your family who are all, you're vaccinated, the kids might not be, and they might contract COVID from those kids. So it is a challenging situation, and I'm seeing that with my friends and family, and lots of people. So you're not alone, if that helps.
Not in the least. Let's see, there may be another one. Let's see, I'm gonna scroll down here. So can we talk about the link between substance abuse and behavioral health? How should one approach a family member who appears to be having a substance abuse issue?
Do you want to take that one, or you want me to?
Go ahead, and then I'll chime in.
I think one of the things that I always recommend is really hard, I think, for families to navigate when they have a loved one who's using substances and it's harming them. But my approach is always to really wrap your mind around the fact that this is a medical condition and it's treatable. And so again, like Kitty and I talked about, it never helps to avoid talking about it, right? I think we have to call it out and, talk with our loved ones that we're worried about them, that we care about them, that we want them to get treatment. And there's really effective treatments out there for substance use disorders. I think the challenge that families have at times is that it can take, an individual multiple times to engage in the right treatment for them to go into remission from their disease. But I always approach this with families just like we would any chronic disease. So if this was diabetes, for example, we'd be very patient with our loved ones as they're trying to navigate changing their diet, and that's so hard to do, or getting on the right insulin to make sure that their body, they're able to manage that chronic illness. And it's no different for substances. I think one of the challenges, though, with substance use disorder, sometimes that comes with some level of behaviors that are really damaging for families. And so it's still okay to set boundaries, but again, encouraging us to approach this from that medical disease perspective, so that we really get people into treatment and into the right care so that they can go into remission from this disease.
Yeah, I absolutely agree. And I think it's helpful to, kind of manage your expectations as a family member, and just always kind of make sure that your loved one knows that you are there if they, when and if they're ready to change.
Great. So there's another question in the box. If someone is feeling depressed and fearful, how do you make the first step?
I think that's a great question. I think that I would say the first step would be to talk to your primary care provider, because they are a lot of primary care in this area that have integrated behavioral health. That might be the first step, or at least they can help you get connected with the next step. So that would be my advice.
We have time for a few more if there are other questions out there.
The other thing I just say to that last question, just one more thing, is that, Katie and I do what we do because people get better. And so I always like people to know, if you're feeling like it's really challenging to take that first step, whether it's talking to your primary care doctor or talking to a loved one and letting people know that you're struggling, that people do get better. Depression gets better with treatment. And so just really encouraging you to know that and to develop some hope around the fact that if you get care, you will get better. Just start wherever you can.
Great advice. Start where you can. Well, if there are no other questions, and I don't see any more in the chat box, I'll again really thank our panelists, Dr. Katie Gilligan and Laura Knapp, for their expertise, time, and really clear explanations of what can be a difficult subject matter to talk about. And I really want to thank all of you for joining us this afternoon. We hope that you got to know us a little bit better and learn something about behavioral health and learn something about how our team here at Prov Everett is here to help. We really appreciate your partnership and wish you a great evening. Thanks very much.
Thank you.